Hello everybody and welcome back to my YouTube channel. This is Dr. Mridula V. Amarnath. So let me ask you, how is your journey of pregnancy going so far? I hope it's going safe and wonderful. I hope you're enjoying every little day of yours. I know certain days can be a little difficult, but just go through it, just flow with it, and certain days are going to be absolutely beautiful for you. So today I'm just going to talk about one topic which can be a little distressful. Okay, so how do you know if you had a miscarriage, and if you had, what do you do about it? Right? It's a very painful topic because none of us want to have a miscarriage, right? But I would say probably only a very small percentage of women go through it. But I wish none of us have to go through it. And what are the symptoms? How do we know that we've had a miscarriage or we're having a miscarriage right now? And what should we do immediately? So stay tuned to know more. So like I said probably in my previous video, bleeding is the most common sign that you will know if you've had a miscarriage. So bleeding, probably almost half a cup of blood would be lost. Along with that, you will have severe cramps. Okay, and sometimes if you notice in the blood, there would be a lot of blood clots. Probably thick round blood clots. These are basically nothing but fetal tissues. Miscarriages, if you take a study, miscarriages happen in almost 15% of the pregnancies. Now it is quite sad because it's not something that you expect, and most of the mothers, they end up blaming themselves that probably there's something wrong in what they did and that's why such an episode happened. Well, it is not true. Probably they say that it's a body's way of reacting if there is an abnormality in the fetus. So, it's just a natural process. A lot of women believe that probably it could be because of work, exercise, having sex, or having a fall could be the reason for miscarriage, or even certain physical conditions such as being overstressed, fright, morning sickness. But let me tell you, these are generally not the common reasons for miscarriage. But then, a lot of women, they eventually tend to blame themselves for it, which is absolutely wrong. It is not your fault. So do not feel bad because of any of these above factors which I have told you. Most miscarriages seem to happen by chance and are not likely to happen again with your future pregnancies. Now, more than 50% of the miscarriages are due to problems with the chromosomes of the fetus. Now, these chromosomal problems occur randomly. Now, when the egg and the sperm combines, a lot of process takes place, right, to have a normal fetus. If a mistake occurs with the number of chromosomes, or probably the structure of the chromosome, then miscarriages can occur. I usually tell my patients that, not to worry. Probably it's God's or the nature's way of telling you that there is some abnormality, some genetic or chromosomal abnormality in the fetus, and probably the fetus will not thrive even in the future. So it's just a natural way of protecting yourself. So that's a way that you should also try and believe. So the moment you notice any of these symptoms, rush to the doctor. Let me tell you, do not delay. Immediately rush to the doctor. So the doctor will completely do a physical examination and also do an ultrasound scanning and a couple of blood tests. Probably in the initial few days, some of them might not be able to identify or diagnose. So they still wait for another 2 to 3 days probably, and then do a repeat ultrasound. But in some cases, the very first ultrasound, you can diagnose that a miscarriage has happened. So once the diagnosis of miscarriage is being confirmed, then there are two options that you can go for. So ask your doctor what are the two options. So one is called as dilatation and curettage. So dilatation and curettage, or what we call as the D&C procedure. Now this is a surgical procedure whereby the doctor removes the pregnancy from the uterus. Now this is usually performed in an operation theatre where you'll be slightly sedated. Some women would like to avoid surgery, so they would go for the second option, wherein they would choose to pass the fetus and the tissue naturally on their own. So in this case, your doctor might prescribe a medicine that will cause cramping and assist the tissue passage. Now, if you choose this option, make sure you contact your doctor if your bleeding is extremely heavy. Heavy in the sense, I would mean soaking of a pad over an hour or probably 2 hours. Okay, or if you're experiencing severe pain. So like I said, having a miscarriage is a very distressful and a painful situation for you and for the people around you. And I'm sure it's definitely more for you because you're going through that pain, and it is quite, a very, very painful, distressful condition. So the take-home message would be, the moment you notice any bleeding, rush to your doctor. Second thing is, if the miscarriage has been confirmed, then you have two options and you can choose whichever you would like to go for. Next option is next thing which you will have to keep in mind is, even if you've had just one episode of miscarriage, you can still continue to be pregnant, because our uterus and our cervix are structured in such a way that probably even in a month's time they would come back to their original position, original anatomy and structure, and you can get pregnant again. But if you had miscarriages, back to back around 2 to 3 times, then it is important that you discuss with your doctor about this and probably get a genetic and a chromosomal analysis done, so that it will be safer for you and you can continue your pregnancy in a safer way. Okay, so stay safe. Bye bye.